This is the Philippine Orthopedic Center, a 700-bed tertiary hospital popularly known as the bone repair facility of the country. While it houses hundreds of patients stricken with musculoskeletal disorders, POC is seen not just a place for treatment, but also considered home to hundreds of hardworking nurses dedicated in serving the public.
I will go so far as to say that the hospital cannot exist without nurses. They are the vital link between doctors and patients. Aside from that, they are also frontliners in a way. And without them, I believe there will be more problems in the patient care.
We are proud to be nurses of Philippine Orthopedic Center, one of the specialty hospital, because I think we have edge over the other nurses. That is, we are only catering to orthopedic related cases. And of course, one of our objectives is to provide quality care, orthopedic quality care to our patients.
Over the years, the tradition of providing safe, quality care to patients with musculoskeletal disorders is meticulously maintained by the following leaders of the nursing department, anchored to its mission and vision to deliver services in accordance to highly acceptable standards as public healthcare providers.
So here in the Philippine Orthopedic Center, we are proud to have the different kinds of services which can only be found in this hospital, namely turning, the bladder care for acute spinal cord injury, the different kinds of traction, which is the most common is the balanced skeletal traction for the fractures of the hip and femur, the different cast application that varies from the different orthopedic conditions, the long-term treatment and management of acute spinal cord injury and other related conditions, then the multiple fractures with multiple fixations.
The Philippine Orthopedic Center is a unique facility catering to patients requiring particular types of care, and certain practices can only be found best performed in some of POC's special wards.
One of the important aspects in orthopedic care is the role played by a bladder nurse. You don't usually find this type of care in other hospitals.
The Philippine Orthopedic Center is proud of having a 5-man turning team. The turning team aims to prevent pressure ulcers. Researches and studies have shown that if patients are not turned every 2 hours at the minimum, they may develop pressure ulcers that may lead to further complications for the patient.
POC is a specialty hospital catering to patients with musculoskeletal disorders. Now, one thing that we can find here, aside from other hospitals, DOH retained hospitals. Now we have specific beds for patients in tractions. We call that as orthopedic bed. It's composed of Alcan frames, it has trapeze, it has pulleys, and the most common traction you can find here is the balanced skeletal traction, which is indicated for patients with problems either on the hip and femur.
So one unique procedures that we have done here in our institution is the casting. Casting is used for patients with undisplaced fracture or with incomplete fractures, and also it is used for conservative treatment of our client.
Along with those activities, new branches of care have been thoughtfully introduced to accommodate patients requiring special concerns, such as the TB dots and the ECG service. And as part of the hospital's innovation, more special clinics have been opened, such as the osteoporosis clinic, the tumor clinic, and the diabetes clinic.
We have to remember that the Philippine Orthopedic Center has been designated as the apex hospital for orthopedic services. We need nurses who are trained or who are more knowledgeable on conditions like osteoporosis. That's why we have an osteoporosis clinic.
While nurses at the Philippine Orthopedic Center continue to be in service to fellow Filipinos, care isn't just confined to its vicinity. Whenever needed, nurses are dispatched whenever required to render their duties anywhere in the Philippines and abroad. Meanwhile, despite being seen as flexible professionals, back at the clinical areas, nurses are prone to be overwhelmed with certain challenges in their duties. This is where their workplace becomes a ground that will sometimes test their physical and emotional endurance.
Of course, in order to achieve continuous care in rendering the patient's health care, usually the problem arises from number one, understaffing. Number two is the patient-nurses ratio due to high volume of demands. We are dealing with different types of stressors, either it's physical, emotional.
It's stress and burnout. That's a major cause of almost all our problems that we encounter in the world. I guess you have to balance everything out. You can treat them as a family, like especially the young ones, you can treat them as like brothers and sisters. Appreciate them if they do something good, and at the same time, if they do something that's not necessary, you have to be able to make them accountable of their actions. At least give them a sense of responsibility.
How you use that sense of humor in coping up with this difficult people. Yeah? As sa akin kasi, you have to learn how to laugh it out to be able to endure this kind of work, you know. So sasabi ko lang, whenever we have problems, we expect that there is a corresponding solution to whatever problems we encounter. Yun lang, it's all up to us how to find these answers.
But for all the challenges they face, it is simply reciprocated with festivities. These are times where nurses can slip away from the griefs of reality, a chance to restore their spirits and to bond with fellow colleagues as one family in this commemorative time. And for the first time ever in the history of the nursing department, in line with the celebration of the Philippine Nurses Week and spearheaded by Chief Nurse Lauren Libunao, a mega event is held to bring together the nursing family based locally and abroad. A grand occasion is launched, the Dream Gala Night.
Attending festivities or organizing activities like this is one way of releasing the tension among nurses and thus improving the efficiency and effectiveness of their mind, their body, spirit, and their relationship with other people as well as to their co-workers.
In line with the modernization program of the Philippine Orthopedic Center, one of the priority programs of our chief nurse is the learning and development of our nurses. We want our nurses to be competent in all aspects, especially now that we have the DOH Nurse Certification Program, wherein our hospital is the one in charge for the certification in orthopedic and rehabilitation nursing. Just recently, 3 of our nurses were sent to Singapore for training in orthopedic nursing under the Nurse Certification Program.
Along with POC's modernization, nursing skills are kept up to date through various programs, trainings, and seminars, maintaining competency as it goes side by side with today's advancing technology. Truly, these are exciting times as our nurses embrace the challenges and trainings while moving ahead in establishing the Philippine Orthopedic Center in becoming the premier center of excellence in service to the Filipino people. With its pursuit in providing safe, quality care, it's no wonder that the nursing department has garnered various awards within POC and the international arena. These are accomplishments which are considered milestones, proof that their outstanding achievements can produce successful nurses with world-class standards our country can be proud of.
So much has happened over the years, and as we move along with the rapid technological advancement, we can expect that the nursing division can keep up with the times through learning and development programs, upgrading and modernization of POC to provide accessible ATIC services and orthopedic and rehabilitative care to all. We are looking at exciting times ahead as we progress and move towards new horizons in continuing quality services to our clients. To all our nurses in POC, keep up the good work.
Whether you are currently employed as a staff nurse at the Philippine Orthopedic Center or has rendered service at the institution for some time, you'll be glad to know that the nursing department continues to develop and improve along with the new technologies, moving onwards to new horizons in the years to come. And one thing's certain, that no matter where you are in the world, we're proud that you belong to POC.